Welcome. I'm Dr. Jeff Borenstein. Everyone is touched by psychiatric conditions, either themselves or a loved one. Do not suffer in silence. With help, there is hope. Today, on Healthy Minds,
the first episode of psychosis can be a very frightening experience. And when you have those symptoms, they're very, very frightening for the individual. And often the youth won't even mention them to anybody because they keep it inside.
The idea is to provide a one-stop shop as much as possible so that most of the services that the youth and parents need are under one roof and very easy to access. Every door is the right door into help.
That's today on Healthy Minds. Healthy Minds is brought to you in part by the American Psychiatric Association Foundation, the Graham Beck Foundation, the New York State Psychiatric Association, and the New York State Office of Mental Health. Today I speak with two people who are working to transform our mental health system to improve care, especially for young people. I first speak with Dr. Ann Sullivan, Commissioner of the New York State Office of Mental Health. We discuss initiatives to improve early detection and treatment, which are now being pioneered in New York. Ann, welcome. Thank you for joining us.
It's a pleasure to be here, Jeff.
One of the areas that I know you're interested in has to do with youth mental health, and in particular, early diagnosis and treatment of youth at risk of schizophrenia or who have developed schizophrenia. And I'd like to ask you a little bit about that.
When you look at the length of time it often takes for an individual who has schizophrenia or who has any of the early signs of schizophrenia to get treatment, it can range an enormous amount of time, anywhere from months to years, before they actually get the treatment they need. And we also know that if you don't get that treatment early enough, that the progression of the illness can be more severe. So it's really critical that we get the word out there to families, and we get the word out there to practitioners, we get the word out there to schools and others to notice when there are signs and symptoms of schizophrenia and to get help early, because recovery is truly possible. People can live very full lives, but we really need to get them into treatment early.
What types of symptoms or behaviors should a family be looking for in their loved one?
You know, it can vary a lot, but I think it's usually something begins to change. Parents notice that something's going on that's different. And the difference can be some degree of withdrawal, difficulty in school, usually grades begin to get affected, distractibility, not concentrating as well, getting preoccupied, and seeming to be less social is often one of the signs. Families sometimes see it as kind of almost like a depression. Kids can get very preoccupied with certain thoughts or issues and really lose the social connectedness that they had before. And if you begin to see that happening, you should seek help. And you should just get an evaluation and see. You know, there's often a question of, well, is it just normal teenage kind of problems, or is it something more serious? And I think parents often know. They know when there's a sense that something has drastically changed with their child or is beginning to. Just get an evaluation. Just ask somebody to talk with your son or daughter and see what's going on. Don't be afraid. Don't be afraid to seek help.
And use your own intuition as a parent. Parents
Absolutely.
know their kids well. If they think there may be something wrong, it makes sense to go and check it out and see whether or not there is and what should be done.
And not to feel bad about it. You know, I think one of the things parents often feel, I feel that with my own children, when they're having trouble, somehow you're responsible for it. You're not responsible for these issues, but you can be helpful for these issues. So don't be afraid to ask for help, and don't feel that it in any way shows your problem as a parent. Go forward and just ask for help for your child.
Just as if you were concerned about a medical problem, such as if the child had a cough that didn't get better, or some other physical ailment. If there's an ailment of the brain, don't hesitate in seeking assistance.
Yeah, and I think we still face the stigma. Stigma is one of those words that you wish would just go away. That mental health, mental illness is something different, something to be hidden. But it's not. You're absolutely right. It's no different than diabetes or asthma or other things that you seek help for. It's an illness of the brain. And for that reason can feel sometimes to families to be more concerning, or they worry about it more. But it can be treated and it can be dealt with. But you've got to kind of get help.
One of the programs that Office of Mental Health in New York has put together is called On Track New York. And I'd like you to tell us about that program.
On Track New York is a very exciting program. It provides the kind of help to individuals who have their first episode of psychosis. And that's usually in mid to late adolescence. Ages for this program are like 16 to 30. What it provides is a team that comes together to work with the individual, the youth, and with their families to understand what's happening. A first episode of psychosis can be a very frightening experience. It often involves hearing voices talking to you. Sometimes they can be very derogatory voices. Sometimes they're not. They're distracting. It can involve ideas, or what we call delusions, which are fixed ideas that maybe someone is out to harm you, or that you have to do certain things in order to prevent someone from harming you. And when you have those symptoms, they're very, very frightening for the individual. And often the youth won't even mention them to anybody because they keep it inside. So once that happens, once you have that psychotic episode, it's critical that you have a team that works with the individual and with their families to understand what's going on, and to help them understand that this does not mean that they're not going to be able to continue in school, or to get a job, or to have a full life. Then On Track New York makes that happen for individuals early and prevents the long-term sequelae of schizophrenia if you don't get treatment. So, for example, there's a recovery coach, someone who works with the individual on issues like school, issues like a job. What are your goals? You ask the youth what their goals are. You don't impose treatment on them. You work with them and the family. You share decisions. You work together to plan goals and to plan a future. And usually it's a team of a psychiatrist, a nurse, a coach, and a specialist in education and job seeking that work with the family and the youth over a period of like 1 to 2 years after that first episode in order to help them be able to kind of organize the way they want their life to be, to learn certain skills. So it's a very intensive program. This entire team will work with only 30, 35 individuals and work for a period of anywhere from 1 to 2 years and longer if necessary, just to help the individual really understand how to manage and work with their illness.
And research has shown very clearly that this type of approach with an individual, with a family, makes a big difference in helping them move forward with their life.
Oh, absolutely. And, you know, On Track New York and just the programs that we've started to do in the state, basically individuals come in, usually about 40% maybe are in school or have a job. After a year, 80% are in school and have a job. So we double the involvement of those individuals in the goals of life that everybody wants. Everybody wants to have a job, a family. They want to be able to feel fulfilled in life, and that's what the On Track New York helps youth do.
That's a great track record.
Yeah, so far, it's excellent. It's excellent.
Wonderful, wonderful. If there's a parent watching right now and they're concerned about their child, what do you say to them?
I say, if you're concerned, then speak to someone. You can either go to your primary care physician and say to your primary care doc, I have concerns. You can go to a mental health clinic. You can go to a psychiatrist. You can go to a school counselor. But if you're concerned, don't keep it inside. Go to individuals who can be helpful. Go forward, ask, explain your concerns, and get some advice as to how to approach those concerns with your son or daughter. I think the key issue here is just what you had said before. If your child was complaining of belly pain, or if they were having pain in their leg or their knee, you wouldn't think twice about going to your doc and saying, my son or daughter has this issue. It's the same thing. You should go forward and say, I'm concerned. He or she hasn't been sleeping well. He or she seems more preoccupied with inner thoughts. They don't seem to be talking as much with me or with their friends. Something's changed. How can I get some help?
Very good advice. And I want to thank you for the work that you're doing. And thank you once again for joining us today.
It's a pleasure to be here. Thank you, Jeff.
Mental health is an issue that touches us all, either personally or through family and friends. Graham Beck grew up as a friendly, passionate, and sensitive boy with many friends. He was an accomplished athlete, outdoorsman, and student whose life began to unravel as the symptoms of schizophrenia began to take hold. Graham tragically died at the young age of 22. Now, the Beck family aims to be a catalyst in bringing about transformational changes that significantly improve the lives of people with mental illness. Graham Beck's brother, Ian, is the president of the Graham Beck Foundation. Ian, welcome. Thank you for joining us.
Thank you for having me, Jeff.
I want to ask you to tell us a little bit about how you got involved in mental health.
Well, my family has a foundation called the Graham Beck Foundation, and really it was founded by my parents, Ray and Tony Beck, and it's named in honor of my brother Graham, who had schizophrenia, and he died from complications of his medication. And this was obviously a very difficult experience for our family, so we wanted to really make a difference for people who have mental illness or at risk of developing mental illness. And so that's how we developed the foundation, and we have some projects that are really aimed at having a big impact on the mental health care system.
Your goal is really to help have an impact so that other families don't experience the tragic loss that your family had.
That's exactly right, Jeff, yeah.
So tell us about some of the projects that you've been involved in.
We consulted with many people and thought very carefully about how we could have impact. And really where we landed is youth mental health, is early intervention to try and help people before they become very sick. And we know that because most mental illnesses have their onset early in life, this is really the key period to really have an impact and reduce the burden on youth and families from mental illness. And much of what we do is really inspired by the incredible work that has come out of Australia and pioneered, in fact, by Pat McGorry. So the Headspace model, which is basically provides integrated services in the community, and it wraps up a whole bunch of things that we need to do to have good youth mental health services into a coherent model. And so what we've done is we've co-funded a national network in Canada with the Canadian Institutes of Health Research, which is our national health research funder, sort of the equivalent of the National Institute of Health. And so this is a large pan-Canadian project, and really the goal is to show how youth mental health care can be transformed in a variety of settings, from inner city settings where there might be lots of homeless youth to suburban and rural, even Aboriginal communities and even Inuit communities up in the high Arctic. And so we're very excited about this as a way to really create a new model that will really help youth and families to get quick access to service and really provide the high quality services that they need.
So developing a new approach to the system of care so that even with current forms of treatment that are available, people are able to get the help that they need.
Exactly. So the first thing we need to do is make it easy for people to get help and encourage them to get help. And so the idea is to have a well-known place in the community where people know they can get help. And then the next thing is to make it easy to access. So the idea is that youth can just even walk in off the street and get help. They can get appointments by phone or internet chat. And so every door is the right door into help. The idea is to provide a one-stop shop as much as possible so that most of the services that the youth and parents need are under one roof and very easy to access.
So you don't have to go to this type of a clinic for one thing, to that type of a clinic for another. You could go to one place and the door is always open.
Exactly. And you know, a lot of times youth and parents, they don't know what the problem is. All they know is things aren't going well, youth is going through a tough time. And this is a place where the youth and parents can simply go, and people who are friendly and want to help can help to sort things out and work with the youth and parents to decide, well, what services are needed, and then they will get those services to the youth.
So no problem is too big, no problem is too small to go in through the front door and see what type of help might be available.
That's exactly the idea. The idea is basically no one is turned away, and it's not siloed in terms of, well, we deal with this type of problem here, but if you have this other problem, then you got to go over here or whatever.
And wait another few weeks for an appointment to get there. There's none of those issues that stand in the way with this model.
That's exactly right. So what you could say, it's built around the person who needs help. And so I guess you could say it's person-centered care.
I think one key message for people watching now is, while this new type of system is being implemented, many places don't yet have this available. But the ideal of this, and what you just said, of the youth and the parents and other people working together, is a key ideal. And even in localities that don't have this type of a system in place, this should be the approach that families should take in seeking treatment for their loved ones.
Yes, absolutely. And even if the services can't be integrated under one roof, what can happen is the various organizations that provide care can get together and can work together more seamlessly. And that in itself can have a powerful impact in terms of making the services available. And you know, all too often what happens is youth fall through the cracks. They get discouraged, or their first encounter with services is a bad one. And so we really need to have, create a safety net where youth don't fall through the cracks.
As you've pursued this, what have you found? How has it gone so far?
It's actually gone very well. There's an extraordinary amount of support for this, and really from all parts of the mental health sector. And when youth or parents are told about this idea, they instantly recognize it as something that would be very helpful for them.
I want to shift gears to another important project that you've been involved in, which relates to the International Alliance.
Yes.
Tell us about that.
One of the things we've come to realize is that the mental health sector is too fractured. There isn't enough collaboration. And so everything we do, we try to promote collaboration and unity in the sector. And so one of our projects is called the International Alliance of Mental Health Research Funders. And this is a project to increase collaboration internationally in mental health research. Basically, the idea is to try to get mental health research to move faster and to have the benefits from that research come to patients and families in a more timely manner. And so this is a collaborative of many of the largest research funders in the world. And we think that this is really an exciting opportunity to be able to take out some of the roadblocks that are preventing mental health research from moving faster and creating more tangible benefits for society.
I think one of the important components is that this is a worldwide effort. and research is going on throughout the world. This is a problem that knows no boundaries, and the more that can be brought to the table together, the better we all are.
That's right. When we look around the world, there are the same mental health problems everywhere, and there's actually a lot of research that goes on in many countries. But there isn't as much collaboration as you would think, and there's duplication of effort, and there's some real opportunities to figure out what are some specific areas that the world can collaborate on to speed up the research. We think one area is in youth mental health. We also want the Alliance to study the landscape of the global mental health research funding, identify where the gaps and where the obvious places where we could promote collaboration.
And what have you found so far in this process?
When we talk to many research funders, they all know they need to collaborate more, and they need to collaborate more internationally, but they don't really know how to do it. And so they're very keen to pursue this project, and in fact, this project should be able to provide the ideas and the management to actually make it happen. But when you look at mental health research, there's so many things that need to be done, and so, but really the hard part is figuring out where do you start. And as I said, I think there's some real opportunities around youth mental health and the tremendous leadership that has come out of Australia.
One of the challenges is bringing basic research and other clinical type of research to the patient, to the clinic. And I'm curious what your perspective is about that.
I think, another thing we find in talking to many research funders is that there has been more of a focus on sort of the biomedical and basic research rather than actually getting treatments and services directly to patients. They all know that they need to move in that direction, and that's what society is telling them they need to do. But it's not always easy for them. And so one of the things we can do is highlight successful examples from around the world where research has been translated into practice. And they can learn from these successful examples, and they can be inspired by them. And so that's really part of what role the Alliance can play in the world. And we think it can be a powerful force.
Your work and mission is one of hope, and it stems from a personal family tragedy, but it really has resulted in hope for many people. What do you say to somebody right now who's watching the show and has a loved one that, a youth, a young person, that is suffering from one of these conditions? What do you say to them?
I would say to them that mental health is something that has been obviously neglected in society. And society is hungering for solutions and is hungering to make our services better. And so, if you can roll up your sleeves and try to make a difference in some way, I think you'll be very surprised at really the impact that you can have. And it's often individuals, small organizations, small foundations that can come up with the out-of-the-box thinking that can really make a huge difference in the world. And I think that's what we've found with our foundation. We're a small foundation, but we've tried some novel things, and they appear to be working, and they appear to be needed. And so this is an area where you can have big impact because it has been neglected. And so, I think if you roll up your sleeves and, you put on your thinking cap and maybe think a little bit about out of the box, it's amazing what difference you can make.
The need is so great, and the opportunity is even greater to have an impact. Ian, I want to thank you for the work that you've done and your family has done on behalf of all people who have mental illness, and on behalf of people in the future who will benefit from the work that you're doing. And also thank you for joining us today.
Thank you for having me, Jeff.
Improvements in our mental health system offer new hope for young people. The key is early detection and treatment. All young people, including those who have a psychiatric illness, deserve the opportunity to live a full, productive, and happy life. Remember, do not suffer in silence. With help, there is hope. Until next time, I'm Dr. Jeff Borenstein. Goodbye. With help, there is hope. Healthy Minds is brought to you in part by the American Psychiatric Association Foundation, the Graham Beck Foundation, the New York State Psychiatric Association, and the New York State Office of Mental Health.